The paper, CMV Retinitis, the neglected disease of the AIDS pandemic, appears in the World AIDS Day issue of PLoS Medicine, an open access, freely available journal. I've been asked by Dr. David Hayden of CMV Foundation to speak on behalf of the 14 collaborators in this work. I'm David Wilson, a doctor working with the international non-governmental organisation Médecins Sans Frontières, or MSF, and I have experience of working in HIV/AIDS projects in China, Thailand, Cambodia and Myanmar, 4 of the countries discussed in this paper. Médecins Sans Frontières began providing treatment for people with HIV/AIDS with antiretroviral therapy in the year 2000, Thailand being the first country. I remember the first patient very well, but for a most unfortunate reason. She was a young single mother who very quickly became blind from immune recovery uveitis due to CMV. 2 years later, in one of our first projects in Cambodia, the first patient to receive antiretroviral treatment was a young man who also went blind within 2 months from the same reason. His family couldn't cope. They took him to a rice field where they abandoned him. So we asked ourselves, were these just unfortunate examples, isolated cases, or was the problem more substantial? Dr. David Hayden of CMV Foundation has worked with us in a collaborative effort with MSF projects in 6 countries, and he's brought together experts from the William Jefferson Clinton Foundation HIV/AIDS Initiative, the Mildmay Centre in Uganda, and with professors of medicine, infectious disease and ophthalmology to look at the issue of CMV retinitis and help MSF projects in the field develop a strategy to diagnose and treat this condition. We've shown unequivocally that CMV retinitis is a substantial problem and is causing blindness in a young population. But not only have we been able to raise awareness of the problem, the work on the paper has helped us develop a strategy for diagnosing and treating this disease at the primary care level. For many years, together with colleagues in MSF projects in the field, we've been frustrated by lack of diagnostic and treatment capacity for this opportunistic infection, and that's why it's been a privilege for me to work on this paper. Last week, Dr. David Hayden worked with us in Laos, where we showed the CMV retinitis problem is similar in prevalence to other settings in Southeast Asia, and where Lao doctors, with quite a short period of training, gave treatment for this condition, which has never been treated before in Laos. So we really hope that this paper can be a stimulus to increase access to treatment for this blinding condition in many countries. Thank you.